Alien hand syndrome, AHS, a perplexing and often unsettling neurological disorder, presents a profound challenge to our understanding of agency and the intricate relationship between mind and body. In this rare condition, an individual experiences involuntary, seemingly purposeful movements of one hand, or, less commonly, a leg, without conscious control, fostering a disturbing sensation of a limb operating with an independent will. This essay will delve into the multifaceted nature of AHS, exploring its symptomatic expressions, underlying neurological origins, the complexities of diagnosis and treatment, and the profound impact it has on the individual's sense of self and autonomy. The clinical manifestations of alien hand syndrome are as varied as the specific areas of brain dysfunction that precipitate it. At its core lies the phenomenon of involuntary movement. The affected hand may engage in a spectrum of actions, ranging from simple grasping and manipulating objects to more complex behaviors like buttoning or unbuttoning clothes, touching the individual's own body, or even actively interfering with the intended actions of the other hand. This latter phenomenon, known as intermanual conflict, vividly illustrates the internal struggle as one hand strives to execute a task while the alien hand actively sabotages the effort. Beyond the physical movements, a defining characteristic of AHS is the accompanying sense of loss of control and ownership. The affected limb may feel foreign, an unbidden guest attached to one's own body, operating under the dictates of an unknown force. This can lead to feelings of frustration, alienation, and even autocriticism, as individuals may find themselves verbally or physically reprimanding their own errant limb. The etiological roots of alien hand syndrome lie in damage to specific regions of the brain, disrupting the delicate neural pathways responsible for motor control and voluntary action. Cerebrovascular events such as strokes, particularly those affecting the anterior cerebral artery or the corpus callosum, the neural bridge connecting the two hemispheres, are significant contributors. Neurosurgical interventions, especially procedures involving the separation of the hemispheres, can also inadvertently trigger AHS. Traumatic brain injuries, brain tumors, and certain neurodegenerative diseases, including corticobasal syndrome, Alzheimer's disease, and Creutzfeldt-Jakob disease, have also been implicated. The precise location of the brain lesion often correlates with the specific symptomatic profile. For instance, frontal lobe damage may manifest as grasping and groping behaviors with difficulty releasing objects, while parietal lobe lesions might lead to more undirected movements and a stronger sense of the hand being foreign. Damage to the corpus callosum frequently results in the characteristic intermanual conflict, predominantly affecting the non-dominant hand. Diagnosing alien hand syndrome relies primarily on careful clinical observation and a thorough neurological examination, documenting the specific involuntary movements and the patient's subjective experience of loss of control and alienation. While there is no definitive diagnostic test, brain imaging techniques such as magnetic resonance imaging, MRI, and computed tomography, CT scans, play a crucial role in identifying the underlying structural abnormalities in the brain that may be responsible for the syndrome. Currently, there is no specific cure for alien hand syndrome, and treatment strategies focus on managing the often disruptive symptoms and improving the individual's quality of life. Behavioral therapies aim to enhance awareness of the involuntary movements and potentially foster a degree of conscious control. Techniques such as visual feedback and distraction can sometimes redirect the alien hand's actions. Constraint-induced movement therapy, which involves restricting the unaffected hand, may paradoxically encourage more controlled use of the affected limb in some instances, though this approach can be challenging given the involuntary nature of the movements. Pharmacological interventions such as botulinum toxin injections to weaken the muscles of the alien hand or certain anti-seizure medications may be employed to mitigate the severity of the involuntary movements in select cases. Occupational therapy plays a vital role in helping individuals adapt their daily activities and develop compensatory strategies to navigate life with an unpredictable limb. The experience of living with alien hand syndrome extends far beyond the physical manifestations. It challenges the very notion of self-control and bodily autonomy, potentially leading to significant emotional distress, anxiety, and social isolation. The unpredictable nature of the alien hand's actions can make even simple daily tasks fraught with difficulty and frustration. The psychological impact underscores the profound interconnectedness of our physical being and our sense of self. In conclusion, alien hand syndrome remains a compelling enigma in the realm of neurology. Its diverse symptomatic presentations, rooted in specific patterns of brain damage, highlight the intricate neural circuitry that governs voluntary movement and the subjective experience of bodily ownership. While current treatment strategies focus on symptom management, ongoing research into the underlying neurological mechanisms holds the promise of more targeted and effective interventions in the future. Ultimately, Understanding and addressing the challenges faced by individuals living with AHS requires not only scientific inquiry, but also empathy and a recognition of the profound impact this unusual condition has on their sense of self and their ability to navigate the world with agency and control. The unbidden guest of the alien hand serves as a stark reminder of the delicate balance within our neurological architecture and the profound consequences when that balance is disrupted.